Well, for me, I think compassion is an emotion. It's an emotion when you're moved by the pain of others, whether it's physical pain, emotional pain, spiritual pain. And I think critically leads you to do something about it. It motivates you to try and relieve it.
The conference on compassionate healthcare today gives us the chance to reflect on the fundamentals of healthcare, who we are and the difference we make to patients, to their families and to everyone we come into contact with on a daily basis.
Compassion is really shown by having an emotional engagement with the patient, with the service user. There's a lot said historically about professional boundaries and, don't bring yourself to work. And my argument is that you really absolutely need to bring yourself to work and engage with those people as you would any other human being, with as full an emotional engagement as you can. And it's by doing that they will feel supported, they will feel cared for.
Compassionate care, to me, means being listened to, being taken seriously, being understood, and being supported in the decisions I've made. And it's been the difference between coping and surviving and going under and the whole family disintegrating. So it's meant the world. Compassionate care has meant the world to me and to my family.
A little over 3 years ago, when I was 31 weeks pregnant, I was told my daughter Scarlett had died inside me. It was the hardest thing I've had to go through in my life, and I can honestly say that without the compassion shown by the members of staff across the unit, I wouldn't be standing here today.
Over the last 3 years, I've had cause to use the maternity services at the Whittington quite a lot. So for me, compassion really is about delivering empathy, but then going beyond that and really trying to make a difference to make it better for somebody.
If you're admitted to hospital, it's people taking time to really listen to what you're telling them, listen to what you're worried about, making sure that if it matters to you that you only drink tea or coffee, that somebody just offers you that and doesn't give you doesn't keep saying to you, do you take sugar when you've been in there a week? So it's often very small things that demonstrate a much wider concern and compassion for the individual.
Well, I think what we were keen to do was not to debate further, but to showcase, to highlight existing ways of supporting and developing your compassion.
Well, my talk was about birth and the roots of compassion, because there's a lot of evidence that shows that the route in which mothers and babies bond and the neurochemistry behind it is very important to developing compassionate qualities in society.
The reason we came here today was to look at how compassion is something that we work together with service users, clinicians and students, and we really try and pull together an idea of working with compassion for ourselves first. There's a lot of discussion about compassion in terms of giving it to somebody else, but what we've really noticed is it's very important for us to have that and hold that for ourselves first.
It's the easiest way of learning how to deliver compassionate care is to understand how patients have experienced care, both good and bad, so they can learn from it. I'm here really to make sure that those who have given me that incredible care are recognised for what they've done, but also so that others can learn from those experiences so they can also then continue to give care in their own practice.
I think everyone's been fantastic in the feedback that they've given. They've clearly enjoyed the day and got a lot out of it. And I think our aims, our objectives were to sort of really give people an opportunity to explore practical ways in which they can kind of maintain their compassion and build on it and develop it. And I feel that we've achieved that.